If I get corona, I get corona. At the end of the day, I'm not going to let it stop me from partying. You know, I've been waiting. We've been waiting for Miami spring break for a while. About 2 months we've had this trip planned. 2-3 months. So we're just out here having a good time. Whatever happens, happens.
That is absolutely absurd. That's crazy. I can't wrap my head around the fact that people would want to party when, you know, people are losing their lives and people are dying. You know, you're putting people at risk for, you know, asymptomatic transfer of this virus, which is, you know, quite possible. You can have no symptoms whatsoever and still transfer this virus. And this is really frightening to see, to say the least. I thought it was pretty interesting that they had the people's names on the transcription on the screen here, that the whole world can see that, you know, that these people are doing crazy things like this. And, you know, the future employers out there, or the applications that may come across your name, the whole world's going to see this now, that you're acting irresponsible. And, you know, even your parents. I just wouldn't want my name put up on the screen here. You can't deny that, hey, that wasn't me. No, that was you.
Like, it's really messing up with my spring break. What is there to do here other than go to the bars or the beach, and they're closing all of it? It's really messing up. I think they're blowing it way out of proportion.
No, I don't think people are blown out of proportion. I think people are taking the necessary precautions so that this virus, you know, doesn't spread to a level, or get to a level like Italy, where the country is in dire need of, you know, medical professionals, mechanical ventilators, ECMO machines, heart-lung bypass machines. So we are trying to avoid getting to that level, and it looks like we're heading that direction. And when people do stuff like this, we are going to get to that level, a country like Italy, if we don't socially distance ourselves, and if we keep doing things like this. Definitely not blowing it out of proportion.
Bad. We need a refund. This virus ain't that serious.
Actually, it is pretty serious. They say that this virus is actually more deadly than the seasonal flu, just because, number one, there's no vaccine for this virus just yet. Number two, people can spread this virus and not have any symptoms whatsoever, and that's the dangerous part. And number three, there's really no treatment for it. The mortality rate has been quoted around 3 to 4% in some areas of the world, and this is very serious.
It's more serious things out there like hunger and poverty, and we need to address that.
Yeah, I mean, we planned this a long time ago, and it was kind of up in the air if we still go, but like, we're here. I just turned 21 this year, so I'm here to party, so it's kind of disappointing. But we're just making the most of it. We met these other people in our little Airbnb spot. We're just hanging out with them and trying to get drunk before everything closes.
I mean, it sucks, but we're gonna make the best of it. We're enjoying ourselves. It sucks, and I'm from New Orleans, so this really sucks. However, we're gonna enjoy ourselves. We're having day parties all day. It's my birthday, St. Patrick's Day. Turn up.
Definitely not the time to turn up. If anything, we should be turning down.
Just trying to roll with the boy. We're just living for the moment. We're just gonna do what happens when it happens. When stuff closes, we're gonna do it when it closes. But besides that, we're just trying to have the best trip we can.
Definitely not the approach to take. In this video today, we're going to talk about that. So, if I get corona, I get corona. At the end of the day, I am not going to let it stop me. I mean, what are we doing? Lots of reports out there that are talking about social distancing and what we should be doing to mitigate the risk of this virus spreading even further, and people are doing this, or going to the club, or not listening, not taking regard to the precautions that are, you know, that our government has set for us to take. And you know, this is something that should not be taken lightly. I just can't wrap my head around the fact that with everything going on in this world, with the outbreak of the coronavirus, that people would act this way. It's very disheartening. It's selfish on their part. It's, you know, they're not thinking about, you know, the wide impact that this can have. And in my last video, I talked about what coronavirus is and what can people do to decrease the chance of this spreading, or getting worse than what it already is. And you see stuff like this, and you see people that are at the airports and it's 200 people in line, and it's a lot of people in a small amount of space. People at bars or going clubbing, or people online doing hookah. This really boggles me that I just can't wrap my head around it, and it's quite confusing. It's especially as a healthcare professional, a healthcare worker, someone who is, you know, on the front lines, and potentially if someone is doing stuff like this can put my family at risk or other families that are out there at risk. This is crazy. So when people talk about social distancing, what do they mean? Well, with the coronavirus, it's a respiratory viral illness which affects the respiratory tracts. And the way that this is spread, it's spread by a number of different ways. The most common way that it's spread is by respiratory droplets. This is when someone coughs or someone sneezes or someone, you know, spits, any type of respiratory droplets. These get transmitted to the other person, and then this person gets sick. The problem with coronavirus is that it can present asymptomatically, which means some patients may not have any symptoms and can still pass this virus on to others. And that's the reason why this is a big problem here with the spring breakers, or people that are in the airport or still going to different gyms, different mass gatherings, to the movies or different places. This is why it's important. You hear about all the stories in Wuhan, China, as well as in Italy, and where the hospitals are, you know, they're in dire need of healthcare workers. They're in need of mechanical ventilators. They're in need of ECMO machines, which are heart-lung bypass machines. They're in need of personal protective gear. The people that are most at risk are the people with heart disease, cardiovascular disease, diabetes, people who have kidney disease, as well as people who are immunocompromised, cancer patients, patients who are undergoing chemotherapy or radiation. And that's why it's extremely important that you socially distance yourself from other people, especially the people that are sick. If you are sick, I would recommend that you stay at home, and then that you do not go to the ER or do not go to your doctor's office, but to call your doctor or your healthcare provider and ask him or her what you should do, and that person will direct you on further steps. And you may be wondering why the social distancing is so important. Well, in countries like China, where this first originated, a lot of the country is starting to go back to somewhat normal, just because they implemented strict protocols as well as strict guidelines for the people to follow. They closed different restaurants, different bars, different offices, and they essentially contained that particular virus. So that's why it's really important that we try to contain this virus and try to socially distance ourselves from others, especially people that are sick. You may hear the word containment. This is when cases are identified, they're isolated, and then they are contained. And this is what places like Singapore, China, Taiwan have done really well. They have identified cases, they have made entry points for certain places where there is one entrance into a hospital or to a building. They have isolated these patients, putting up different areas in the hospital, or making tents, or putting up areas where patients have similar symptoms so they don't expose everyone else, and they're containing this particular virus. And this is what we have come to. There's different hospitals that are putting up tents, different protocols that are being made. Patients are not allowed to have more than one visitor at the hospital. There's usually one entrance that patients can enter a building, like at our building, and they get screened once they enter that building. All of this stuff is really important so that we mitigate the risk of transmission of this virus. In my last video, I talked about ways that we can decrease the transmission of this virus. That includes washing your hands with soap and water for approximately 20 to 30 seconds, staying at home if you have any symptoms such as a cough, shortness of breath, or fever, making sure that you disinfect your areas of the home, such as your doorknobs, the handles on your refrigerator or your stove or your countertops, because it is said that the virus can stay on surfaces for up to a week. And all this is important because if we reduce the number of infections, reduce the number of cases or the number of patients that require hospitalization or the patients that require mechanical ventilation, which is a breathing machine that we control as doctors, well, this will help tremendously. And I think it's something that's really important that we try to follow. Listen to your state, listen to your government, listen to the federal officials of what they're saying. Here in the Dallas area, lots of the restaurants, the gyms, the public gathering spaces, the churches have all closed due to this. And I think that's a really good step that our mayor and governor have made to try to decrease the chance of this virus from spreading and killing more people than it already has. Specifically in the field of spine surgery, all of our elective cases here are being canceled. We have transitioned to a telemedicine type approach to see patients that need to be seen or the patients that have recently undergone operations, and we need to communicate with these patients. We are checking patients at the door for a fever, if they're having any symptoms, and we're turning them around. A lot of people are wearing masks and making sure that we wash our hands at every opportunity. So we're doing everything that we can do, and it's really disheartening to see people that are doing stuff like this and having really no regard for other people's safety. So social distancing, really important. Make sure you listen to your healthcare providers, make sure you listen to your state level as well as the government and federal level and what they're telling us to do. Isolate yourself if you're having any symptoms, cough, fever, shortness of breath. Make sure you wash your hands up to 20 to 30 seconds with soap and water. Make sure you stay away from people that are sick, and make sure you check on one another. We're all in this together. I know this is something that we will get through. I want to reiterate to not panic. This is something that we have not faced in the past, but I do believe that's something that we will be able to get through. We just have to get through it together. So before you go out with your friends and go to a bar or go to the beach and you're on spring break or go to some mass gathering, I want you to think about the healthcare workers and think about the people that have medical conditions that potentially may put them at risk for death. And I know we will get through this. It's going to take some time, but we can't be doing things like this. We can't.